Today we're going to talk about keloids. Keloids can be very concerning cosmetically, especially on the earlobe and when it's enlarged. Thank you to Virtual Pathology at the University of Leeds for this online slide. Look how big this is. This represents 2 millimeters, so approximately like 1 centimeter on your earlobe. That can be very concerning, especially when it's a site where people can visually see it. Before we begin on the histologic features, one of the treatments of keloids is excision. Excision can lead to recurrence, and so you can have adjunctive treatments like like steroids. And so here you can see this is the keloid that's been excised. This ink represents the margin. Oh, thank you to Dr. Andrew Detrick and Path Outlines for this gross photo of a keloid. So you can see the margins right here. You can see this white, firm, fibrous looking area, and that represents the fibroblasts that make up a keloid. Let's talk about the difference between a keloid and a hypertrophic scar. A hypertrophic scar is increased fibroblasts at this site of injury. A keloid is when it expands beyond the original site of injury. It's a clinical diagnosis, and so we can only just say, it is suggestive of a hypertrophic scar / keloid, and the clinicians will make the final call. But from here, we see an atrophic epidermis, and where the action is the reticular dermis here. There are random scatterings of thickened pink fibrous material with interspersed thin vessels and scattered inflammatory cells. But this is your key thing for keloids. These thickened fibroblasts. So this is what a keloid looks like under the microscope. And you can appreciate how thickened they are. The fibroblasts are not enlarged, they're not hyperchromatic. There's no increased mitotic activity that we appreciate. So this thickened pink material is what you want to see in a keloid. Your differentials include morphea / systemic sclerosis. That will tend to have a more organized orientation of the fibers, of the collagen fibers, as well as the location is hint. Usually keloids are on the earlobe, and it's caused after trauma. Keloids are more often seen in darker skinned individuals, Asians as well. So that's just some epidemiology facts. There's no chance of malignancy of a keloid, so it's benign. It's just very disconcerting for that person who gets it cosmetically. So I'll see y'all next time. Bye.